Hi, everyone. Welcome. Welcome to this show. This time I'm live. And I just want to let you know that I'm excited. It's my birth month, and it's also the Breastfeeding Awareness Month as we celebrate our moms and their wins. We're excited. This month, I actually interviewed a young woman who breastfed her 6 children. She had 2 sets of twins. So if you want to check on my website, if you want to check on my YouTube site, you will see what the interview was like. And we have been encouraging our moms to breastfeed. Reason for that, unless there's some medical problems or so, and they chose not to. However, we encourage breastfeeding because breast milk is golden. It has so many benefits. And so I just want to remind our women, our leaders, our nurses, our healthcare providers to advocate for breastfeeding because together we can make the generations to come healthier by supporting in different ways to see that our babies are being fed with breast milk as much as possible. In addition to that, I must say to those who choose not to or combine formula as a combination, whatever, we do respect you for making your choices, but we're just encouraging breastfeeding, okay? So we all together can make it happen. It's also important to remember that bonding, breastfeeding, carries benefits both the mom and the baby. Resilience, go for it. It might be a little challenging sometimes. And as I've spoken to moms, they'll share their different experiences. And of course, breastfeeding can be challenging sometimes. But with support, with the doulas, with the maternal nurses, the OB nurses, and all the support from the moms, the dads, those who have experienced before, it does make a difference. And of course, when we look at our little babies, when we look at them, those who are breastfed, many times their immune system is so much stronger. Many of them, they don't go to the doctor for every little infection or every little, it passes them. So definitely boost the immune system. Breastfeeding, breast milk. Okay. I don't have much to say today, but as we are coming to the end of August, I just want to remind my new nurses who are in the OB section to help to support in a special way those young moms, those moms, first time moms, and moms on a whole, and encourage them to breastfeed because sometimes they're going to find it so challenging that they don't feel like they want to. They just feel like they just want to just get off breastfeeding. They don't feel like it takes so much time and effort. But recently I spoke to a mom who has just, she has breastfed her baby up to 3 years. And that's interesting because we're encouraging, we're just, we are just, we're just encouraging our moms as much as possible and different institutions that support breastfeeding, like WHO, UNICEF. They are also doing a lot in encouraging breastfeeding because the value of that is unbelievable, you know. So it's not just a mother mother's concern, but leaders, healthcare providers, nurses, community, parents, grandparents, we're all in it together. And you can notice a lot of times, many, many times, babies who are breastfed, the way they look, the way they they act, their behavior, and all of that. Many, many, many times. We're giving credit to breastfeeding because it has so many benefits for mom and for babies. And one of the things about breastfeeding, it reduces the risk. And you can join me in saying it reduces the risk of mothers having breast cancer, also ovarian cancer, type 2 diabetes. Studies have shown that. So it's beneficial. You have to be resilient. It can happen. I've had grandbabies. Uh, at first, for my daughter, it was challenging. For myself, it was challenging at first. But eventually, if you can even get a little of the breast milk, that's important. So try at that and don't give up. If you have someone who can help you along the way, to go for it. If you have something to say on breastfeeding, you can share it on my site. You can share it on my YouTube, Miriam Amanda Smith. You can subscribe there. And you can share the information, a lot of information free for you, and for you. And as I said, I went to Massachusetts recently and I saw this mother and I was talking to her about breastfeeding. In New York here, I went to the optician and I saw a young mom feeding. I was just excited and I talked and she was so excited too. And I said, August is breastfeeding month. I said, I know. So wherever we can be of help to someone else to make the world a better place, a healthier place, let's do that. Thank you so much for listening. And as I said before, Breastfeeding Awareness Month is ending. However, the conversation for breastfeeding continues because it's beneficial, it's important, and it's worth it. Have a blessed day. See you again. Remember, subscribe, YouTube, Miriam Amanda Smith, Instagram, Podcast Mayor, and on podcast is Empowering New Nurses. My book, Empowering New Nurses in the Delivery of High Quality Care, is on Amazon as a bestseller. You got to get your copy. You got to share it with someone. If you're not a nurse, it's okay to read. Information on patients are there. Have a blessed one. See you sometime later.